So much, David, for sharing these strategies. Next, we'll hear from Dr. Jasmine Travers, an assistant professor at NYU Rory Meyers College of Nursing. She's one of few researchers with expertise in health equity and health services research at the intersection of nursing home research, long-term services and supports, and workforce issues. And we're so honored to have her with us today. Jasmine?
Sure. Thank you so much, Catherine. I'm so honored to be here with this panel and follow David, who I work closely with as mentor and as a colleague. So today I'm excited to share with you some work that can help us understand how to dismantle structural inequities behind disparities in community living. Next slide. I thought I'd start off with a story of how I came to this work. This right here is a piece that I wrote back in 2020 after a discussion that my brother and I had around planning for our mother's long-term care needs. My mother had just turned 70 and my brother wanted to talk about how we would navigate financing my mom's potential long-term care if she needed it in the future. He asked about Medicare and I had to explain to him that Medicare doesn't cover long-term care needs. And then he went to ask about long-term care insurance. But because of my mother's age, I told him how costly that would be with very limited benefit. Then we decided it was best to save. So we decided that we would have $100 per month saved across 4 siblings, which would total $400 on a monthly basis and equal to $4,800 per year. And we thought we were doing something. But then when I looked at this in the whole grand scheme of things, it would have taken 10 years when my mom was 80 to be able to cover 1 year of a home health aid. And to cover 1 year of nursing home care, we would have needed to start saving from when we were in my mother's womb. So to say that we, children who are educated, doing work in this space, and had the best intentions of planning for long-term care early, were defeated after that conversation is an understatement. And then I think about the rest of our country, those who are not studying this work and are facing a lot of structural barriers and how they are navigating staying in the communities that they want to stay in for as long as they should be able to stay in them for. Next slide, please. "93% of older adults prefer to age in place in their own homes and communities. But despite this preference, many older adults end up in nursing homes unnecessarily due to unmet needs in the community setting." Next slide. Particularly, a large proportion of users of nursing homes in recent years have been Black and Latino older adults. And unfortunately, these groups are most likely to experience disparities in these settings, such as increased pressure ulcers, increased antipsychotic medication use, falls, and restraints. Which leads us to the in-home study, which stands for Identifying Needs to Help Older Adults Maintain Everyday Community Living through Understanding Unmet Needs Driving Disproportionate and Unnecessary Nursing Home Placements. In this study, we conducted 61 qualitative interviews with Black, Latino, and white nursing home residents, family care partners, staff, and aging policy engaged partners to understand what Black and Latino older adults didn't have in the community, which drove their nursing home placement. What we found were 7 categories of unmet needs. The first was assistance with activities of daily living and basic home maintenance, which includes challenges in getting assistance with meals, groceries, home health aid hours, homemakers, and social workers. The second was challenges in resources or services, which included challenges in accessibility and availability of resources, senior centers, for example, daycares and meal programs, and the complexity of insurance systems that David just talked about. The third is individual preferences, which was simply an individual's preference to not access some or all long-term services and supports because they just didn't want to have someone in their home, for example. The fourth was equipped, available, and supported family, which included lack of knowledge on resources available to reduce burden for family care partners. Family care partners talked a lot about not even knowing what types of resources were available and how they might best care for their older adult loved one. The fifth was function of the home, which consisted of the accommodation of the home to meet the needs of the older adult, safety concerns, and the need for home modifications that would support the older adult to be able to live safely in that home. The sixth was socialization, which included the need for companionship through means such as adult day centers, religious groups, and senior centers. And the last was treatment, which was specific to health treatment for the older adult and included lack of transportation to medical appointments, for example, scheduling difficulties for medical appointments, and a shortage of skilled staff. As far as the root of these unmet needs leading to unnecessary nursing home placements, we found 6 policy-related structural drivers of these unmet needs, which included disproportionate access to services, disconnect between healthcare systems and communities, lack of age-friendly infrastructure, complex long-term care policy, financial burden, healthcare bias towards nursing home care. Let's start with discussing disproportionate access to services. This was characterized by the lack of high-quality services due to unequal distribution of services, workforce shortages, poor outreach, and lack of culturally tailored care. Here, a family care partner describes the lack of information provided to specific groups driving disproportionate access to supportive programs. This article further highlights this disproportionate access and high-quality home health agencies among Black and Latino older adults because of structural and institutional barriers such as residential segregation. Next, driving unmet needs is disconnect between healthcare systems and communities. This is in reference to lack of outreach of healthcare systems and other formal supports into communities to facilitate awareness and use of services and support. Also, lack of awareness on the health system side about what supports are already available in communities and how to direct people to them. A policy expert stated, "There's a challenge on our side, on the information and support provider side, that often we don't have the funds to do the kind of community outreach that we need." Inadequate funding and funding cuts for aging services further creates challenges between healthcare systems and communities. Next is the lack of age-friendly infrastructure, which will be talked about in more detail next. But this is reflective of a desire to stay in the home and community setting, but the home or community not being built to support the older adult in doing so, or resources not being available. This family care partner shared, "We could not make modifications. I mean, we rented and the landlord wasn't willing to make those changes. I don't know if the landlord would have approved it, even if an agency paid for it. I'm not sure that he would have wanted those modifications made." This table here additionally speaks to the specific housing challenges faced by older adults, where 85% of AAAs reporting lack of affordable housing for older adults, 71% reporting unavailability of or long wait lists for subsidized housing, 64% reporting increasing rents, which result in being priced out of long-term rental housing, and 63% report lack of accessible housing. And next, we have navigating complex long-term care systems. Our long-term care system, which David just talked about, is fragmented, and disparate policies can lead to administrative burden, lack of coverage for services, and confusion as people try to obtain necessary care. A family care partner shared, "There are always obstacles dealing with bureaucracy. You don't get direct answers, and you have to have everything. There are very few communities or organizations that will put you at the right place. There's constant phone calls. It's very discouraging. You get different answers." Next is financial burden of long-term care. The significant out-of-pocket costs for long-term care often make care in the community inaccessible. In regards to their older adult loved one, this family care partner shared, "But she wasn't qualified to receive it for a discount or free, so it was so expensive." Here we additionally see the burdens associated with financing long-term care, where 4 in 10 lack confidence they will be able to pay for necessary care as they age, including higher shares of Hispanic and low-income adults. And then right here, we see the realities of financial ruin, this idea of financial ruin being baked into the long-term care system. And unfortunately, we lack an adequate long-term care policy and infrastructure because of challenges getting programs passed or the inadequacy of current programs. Finally, we have a healthcare bias towards nursing home care. Healthcare response during acute health exacerbations, for example, such as post-fall, strokes, infections, are often biased towards nursing home admission. This family care partner shared conversations with the social worker where it was basically kind of negatively received and pretty much advised that community living was not really an option. So to get the care that he needed, he was pretty much confined to a nursing home. So where do we go from here? And David talked a lot about the policy interventions that we can think about, and I'll just go into some that he hasn't, but addressing both the long-term care financing and workforce issues, which David talked a lot about, strengthening financial assistance programs. So a lot of those who were in our study, they talked about not having access to different programs because they didn't have Medicaid, for example. Allocating resources to community-based health and home-based care. So David talked also about different community-based care, such as PACE, a program of all-inclusive care for the elderly, but that is not readily available for people across the country and across states. So how do we create more resources so more of those types of community-based care can be available to folks? Increased Medicaid covered hours of care. Something that was significant among the groups that we spoke to is not having enough hours of home health aides, for example. So really providing more coverage for that. Prioritizing aging in place support. So creating neighborhoods that are conducive for older adults to live in and to experience life in. Implementing affordable housing initiatives. There's a lot of housing burden among older adults that forces them into nursing homes because they cannot afford the houses that they are in, and providing home modification grants as well, so that older adults can have the things that they need in their homes and be able to modify their homes in ways that will meet their needs. Providing diverse social engagement options. David also talked a lot about COVID, and one thing that COVID did was, or during COVID, was a lot of shutdown of social programs such as adult day centers and senior centers. But this is very important for older adults, where there are older adults who have just entered in nursing homes for socialization. Enhancing caregiver support and training, so making sure that we're really supporting our caregivers and providing them the knowledge and information that they need to provide the support that they do, but also respite support. David talks about telehealth services. Another big thing was transportation services that need to be readily available for older adults so that they can get to their appointments and get their medications and get their groceries, for example. And then measuring impact. So as we're putting different things in place and measures and interventions, really understanding what's working and for whom so that we can make the necessary changes. I just want to share with you, bring to your attention the ARP Long-Term Services and Support Scorecard, which this scorecard looks across 5 dimensions to measure state-level long-term services and support system performance from the viewpoint of users of services in the family. So you can look at this scorecard whether you're in one of these states, whether you're a policymaker, policy official, state official, whoever, clinician, researcher, and understand how a specific state is doing across 5 different measures, which I'll go into in a bit. And you'll be able to see where you rank overall as far as your performance in long-term services and supports. And then you can identify what areas in which you're struggling in so that you can say, okay, this is where we need to put our funding or put our time and resources to improve. And then also see what states are doing well in other areas that you may not be doing well in, and can use those states as a resource. So I'll just go over the dimensions of this scorecard. So it has 5 dimensions that really nicely kind of draw in some of the unmet needs that I talked about. So the first one's affordability and access, which it measures affordable services that older adults have access to, ensuring that they have a strong safety net and equitable access. It measures dimensions specific to choice of setting and provider. So do older adults have consumer choice? is there a skilled workforce available to them, measuring shortages, and then is community-based care equitable? Then it measures quality and safety. So are older adults getting respectful care? Are their preferences being honored? Are they having safe settings? And then are disparities reduced? And we talked about some of the disparities that specific groups are experiencing in different settings. And then support for family caregivers, how well caregivers are supported, how well caregiver burden is being limited, and then also how culturally competent the support that is being provided is. And lastly, there's a dimension on community and integration, which talks about the accessibility of services such as housing, if communities are age-friendly, and then if these communities are equitable. So this is something that I would urge you to consider looking at this scorecard and seeing how your states fare in this, and just kind of think about also some of the different policies and programs that are being introduced. David talked about the minimum staffing standards that CMS recently introduced, and the need to continue to advocate for those to support workers. But then also there are some other programs that are being introduced, such as the state master plans on aging, which is looking to provide funding for many states to create a master plan on aging, where you can identify where your state might need to focus on when it comes to this long-term services and support system, as well as other programs such focused on the workforce particularly. And then finally, this is just an image that I took early on in the pandemic when Mr. George Floyd was murdered, and this is a time when older adults was not supposed to be outside. That was a death sentence if you've seen an older adult outside. And then I was riding my bike and I saw these older adults, they were protesting, and I thought that this was one of the greatest acts of solidarity that I've seen, just seeing how these older adults were risking their lives for the lives of other people. So with that, I just end off saying older adults don't want to stop living, even though they might need help with living. I'll say thank you and pass it on over.
Thanks so much, Jasmine.